I'm an Italian physician and researcher who is interested in polioviruses and particularly in their possible role in the generation or development of the post-polio syndrome, a late consequence of polio. We have been so lucky and we are so grateful to Post-Polio Health International who awarded us of a grant for making and continuing a study which was initiated in Italy. This time the study will be conducted by our own group in Italy, in Varese, northern Italy, and by Konstantin Chumakov at the Food and Drug Administration in Rockville in the States. This unit has the abilities and the technology to really give a very important contribute to the genetics of the viruses we are trying to isolate, and we really isolated from post-polio patients. Now this is the first slide which shows how the polioviruses belong to the RNA viruses. These viruses are hitting usually children or adult people and hit particularly the motor neurons in the spinal cord. Motor neurons are cells which are very useful for, or needed, absolutely needed for the motility of the striated muscle. And so people who have these motor neurons destroyed, at least partly destroyed, undergo paralysis in different parts of their body. Anyway, in most cases, there are decades of clinical neurological and neuromuscular stability. That is, these people suffer of some limitations, but these limitations remain stable for a long time. In some cases, the possible consequences are the late sequelae of polio, which means that in the aged people, over 50, over 60, some of those lose autonomy and are linked to external devices or need the help of other people in the family or outside of the family to continue to live decently. The pathogenesis of the post-polio syndrome, in contrast to the polio, acute polio, is really still unclear. Of course, there are cofactors, among them the aging process. The aging process is by itself some kind of disease, one could say. And then there is a general explanation of what happens. It is the distal degeneration of motor units, which means in the polio hit people, the remaining motor neurons become enlarged and play a role which is higher or enhanced as compared to the normal motor neurons. Over time, these new motor neurons and larger motor neurons apparently lose their effective activity, and we arrive to a point where entire motor units are lost and novel weaknesses take place in the patient. So what we have investigated is whether persistent of poliovirus in those kind of patients, the ones who are developing post-polio syndrome, might have a pathogenic role, that is a causative role, and this is a difficult issue. The issue is difficult because we need to understand whether viruses may be still present years or decades, and in some cases we arrived at 70 years after the acute attack. We recruited so many different cases in northern Italy, but our study was a little bit biased towards severe polio cases, that is, toward patients who were attending hospitals and clinics in our area for specific problems. So far, we had little opportunity to investigate people with stable polio. That is, we investigated a lot, over 100 post-polio patients, a few stable polio cases, that is 5 patients so far, which is very limited, and family members of post-polio patients, at least 50, and controls or normal controls or people with neurological diseases other than the polio syndrome. And what we established in this series of patients is that in Italy, at least, the diagnosis of post-polio is made around 50 years after the acute attack. This may really mean that these patients are slowly developing post-polio, or that the clinical diagnosis, precise clinical diagnosis, is retarded by so many different exams, electrophysiological and X-rays and so on, and imaging techniques and so on. In the slide, anyway, there are some dots in red. Those dots in red underline the cases which are attributed to vaccination. And these are not so few, especially in the recent years, in comparison to those caused by wild-type poliovirus. The results are a little bit shocking. We do not detect any poliovirus genome in controls and family members of PPS patients. Actually, no one in blood donors, no one in neurological patients with neurological disease other than polio, and only 2 out of 50 of family members showed poliovirus genome in their blood or tissues. In contrast, post-polio patients were almost all, 87%, affected by poliovirus in their tissue. In contrast, stable polio cases, but this is at this time only 5 cases, is appears to be rarely affected by poliovirus. In summary, the vast majority of post-polio patients carry poliovirus in different tissues in their body. The virus is instead apparently rare in cases with stable polio. We need to recruit more patients of this category to make a statistically significant conclusion. The median time from acute paralytic attack to post-polio is 50 years or something like that. And what is important to the families and people is that these viruses apparently are not transmissible. That is, they are not found in family members of people like spouses or sons and daughters and so on. And the other thing which is emerging from our studies is that persistence of slowly replicating polioviruses is possibly linked with chronic inflammation. And the other point is that in the world, anti-polio drugs and novel antibodies to these virulent viruses are under development. So the aims of the project are twofold. One is the aim of the American group in Rockville at the Food and Drug Administration, that is complete sequencing of the poliovirus genomes coming from post-polio cases we isolated in Italy. And to confirm the nature of those viruses and to compare the nature of those viruses persistently replicating with that of the wild-type viruses, which are acutely replicating and strongly damaging tissues. In Italy, we will complete the study by comparing the prevalence of polioviruses in polio survivors with stable polio, and we have to recruit those patients, versus the prevalence of poliovirus in PPS or post-polio syndrome patients. This will ascertain whether virus persistence does play any causative role in PPS. If this were the case, in perspective, at-risk subjects with PPS patients will be possibly treated with antiviral drugs and or antibodies for preventing PPS development or for stopping its progression. I have to thank the Post-Polio Health International for the awarding this grant, and all the colleagues who are rehabilitation doctors or neurologists and who contributed fundamentally to this study. And I have to personally thank John Hadley and the committee of the Post-Polio Health International in St. Louis for awarding this grant to my group. Thank you to all.